So if we look at the left chart here and the 2023 graph, that's the one in red, the red graph for 2023. It shows us that we are way below the 2022 level. We have experienced 12 consecutive monthly declines, and presently we are 20.5% lower than the March levels for 2022. We peaked in terms of this index in March 2022. So we are presently 20% lower than that peak of last year. Monthly, the decline has been 2.1%, which is driven largely by declines in cereal, vegetable oil, and dairy indices, which have offset increases in the sugar and the meat indices. Now we're looking at the other chart to the right. So we can see the vegetable oil index is continuously going down. It went down 3% monthly. On an annual basis, it's 47% down, uh, driven by availability of vegetable oil. Most recently, palm oil has increased in price, but the other alternative vegetable oils have offset that small increase in palm oil. Regarding cereals, that's the yellow graph on the right chart. Cereal prices, the indices have come down significantly, both monthly at 5.6% and annually at 18.6%. These are driven largely by reductions in the price of wheat, maize, and rice. On a month by month level, wheat prices are down 7% because of increased availability and also strong competition among exporters, including the Russian Federation. There is good competition in the market, and we'll be able to see how some of that decline is being transmitted to our region. The Black Sea Initiative was also renewed in March for another short period. Hopefully, we can have that continuing to keep a ceiling on prices. For maize prices globally are down month on month, 4.6% on account of good harvests in South America and also potential record harvest in Brazil, and also the open flow of the Black Sea Initiative exports out of Ukraine. Regarding rice, prices in March were also down 3.2% due to the imminent harvest from the key exporters, India, Vietnam, and Thailand. Next slide, please. I want to switch to our region, what we are seeing in our region. And I'll focus first on maize grain, the key staple. We have this chart showing the month-on-month increases represented by the blue columns and the annual increases represented by the orange dots. So the monthly is measured on the left and the annual measured on the right y-axis. So I've tried to sort this chart by the absolute value of the monthly increase, starting from the lowest increase, which is in Zambia, Kitwe monthly, to the highest increase we are seeing in Lubumbashi. Uh, Kitwe, uh, on the copper belt in Zambia, we are seeing, oh, sorry. Sipo, can you switch to, yeah, thank you. Sipo, you had gone ahead. Thank you. Okay, so remember, we are talking about grain. So this chart is giving us the picture for maize grain prices. So the first thing is we are having we are currently in our lean season. It's tapering off, but for March, the lean season was still peaking, and with it, prices were also rising for maize grain. You can see from Kitwe to Blawayo, prices were rising. Blawayo gave us the highest month-on-month increase above 25%. But we know this is now a phenomenon during this lean season. But what is notable is the pattern in Randfontein, South Africa, for both white and yellow maize. There has been a fifth consecutive monthly decline in maize prices in South Africa. Quite atypical, but we know the South African maize market has been driven by external factors. The export parity price is being influenced by global factors more than the domestic factors. But notable to note that for the first time, the annual change in prices for maize in South Africa, a key exporter of maize in our region, the annual change has been stable. Prices in Randfontein are very close to the prices last year. I think that is good news for the region. Prices for countries which want to import from South Africa are nearly the same as they were last year. So good news. But we also have concerns for other markets. For example, Lubumbashi, on an annual basis, prices have been very high. Lubumbashi, Dar es Salaam, Lilongwe, Bulawayo, the year-on-year prices, those orange dots, are extremely high for Lubumbashi, Dar es Salaam, Lilongwe, and Bulawayo. You can see for Bulawayo, I couldn't even chart it here. It's 600% year on year. So very high annual increases in maize grain prices. Next slide, please. I want to switch now to the final product from maize, which is maize flour. I have on this chart the price trends for a range of markets from Zambia, Kitwe again, Maputo, Maseru, and the national average for South Africa, Blawayo, and Lubumbashi. Again, when you look at the blue columns, which represent the monthly in change. We have those two markets of Bulawayo and Lubumbashi, which registered above 10% increase from February to March. Lubumbashi recorded 17% increase in the price of maize meal. We know for Zimbabwe, the continuing depreciation in exchange rates is driving a lot of these monthly increases in prices of food. In the case of Lubumbashi, yes, there's a seasonal increase. Inflation also is high, non-food inflation. But what has happened is for Lubumbashi, exports from Zambia, the traditional supplier, have been restricted. We actually are in Lubumbashi at the moment, and Zambia on April 5 imposed a complete ban on maize grain and maize meal exports into DRC. So the whole South Katanga maize and maize meal market basin has had to rely on their existing stocks as well as domestic production, which is yet to reach the market. Prices, particularly at the moment, are extremely high. We're looking at $40 or more in Lubumbashi for a 25 kilogram bag of maize flour. Normally, it costs way under $20. So we have a seemingly price crisis, high price crisis in the South Katanga maize basin, mainly driven by the export ban imposed by the Zambian government. Next slide, please. I want to now share what the trends are for alternative staples. As I mentioned earlier, wheat prices globally are low and they are continuing to go lower. So we can also see this in South Africa. Randfontein price, the first blue column to the left, that's Randfontein wheat grain. The February to March prices were down nearly 6%. So we are having this transmission of lower global prices for food to the region in the case of wheat. In terms of imported rice in Antananarivo, excuse my short notation for Antananarivo, I've labeled it Tana. So for Antananarivo, imported rice prices are stable. Even in Maputo, the imported rice prices are stable. For local rice in Dar es Salaam, local rice price is stable. But for Antananarivo market, local rice price increased by more than 6% from February to March. The other alternatives shown in this chart are cassava products. So cassava in Lubumbashi is trending upwards. These are the two columns on the extreme right of the chart. Lubumbashi cassava flour and cassava chips were 8% and 10-12% month on month in Lubumbashi. As I mentioned, Maize exports to DRC have been restricted, and you can also see this in the price of alternative staple products. Cassava is normally consumed as a composite input into the maize flour. Cassava in Antananarivo and Lilongwe, the prices are stable, which is good news. Next slide, please. This is my last slide, and it's about inflation rates. I have here a number of our countries labeled on the first column, and I'm showing the annual headline inflation rate, the monthly inflation rate, and the food inflation rate. I ranked these numbers according to the food sub-index rate, with Angola being the lowest and Zimbabwe being the highest. Angola is at 7.6% for food, much lower than the headline inflation, which is at 10.8%. Zimbabwe, the food inflation sub-index for March was 128%. So this is the picture. You can observe that for countries such as DRC, Malawi, and Zimbabwe, food price pressures are quite extreme, and we have different reasons for different economies. The headline inflation rates continue to increase. The inflation rates are yet to peak in our region, with the exception of Angola and Zimbabwe. These are the only two countries that registered decreases in inflation. So food prices could reduce after the coming harvest, but fuel costs could remain elevated, keeping the headline inflation levels high. This is what I have for you for this month, colleagues. Thank you very much for your attention.
Thank you. Thanks so much, Jones, for the update on prices. Let's see if there are any questions coming in from the team or from people who are online. Are there any questions for Jones? Please put your hands up if you have any questions. Or you are free to also put it in the chat. Jones, as usual, your contribution is extremely appreciated. And please stay online if you can, even though you are on mission, in case there are any questions that are going to be coming up soon. Thank you so much. So colleagues, I think we can move on in the interest of time to our next agenda item. We have Marjorie online, who's going to be presenting jointly on behalf of UNICEF and WFP on the nutrition update. So I will then hand over now to Marjorie. Over to you, Marjorie.
All right, thanks so much. Good morning, everybody. Just trusting you can be able to hear me well and clear. So,
yes, Marjorie, all clear.
All right, thanks. So just a little bit in terms of the nutrition, where we are at and some progress that has been made in 2023. So next slide. So just for a brief, the nutrition situation is still of concern, and we have a number of countries that remain a focus. So specifically Angola, Malawi, Mozambique, as well as Zimbabwe and Madagascar are the key countries that we are closely following up as a nutrition team. And this is because of a number of triggers, including the current, flooding, as well as the cholera outbreak. But also we have those, the longer term impacts of both the COVID-19, the economic impact, this economic impact as well, and as well as some of the residuals from the previous drought. And just to highlight in terms of the nutrition programming, we have support now being geared towards quality support for severe acute malnutrition as well as moderate acute malnutrition, both at the national level but also at the subnational level. And what we are seeing as of now, we have a little bit of a decline in terms of admission in Malawi and Mozambique, and we'll get to see that later on. For Angola, again, we are seeing a little bit of decline, but it's much more related to supply availability and funding as opposed to reduction in the levels of malnutrition. So I think one of the key things that we are looking at, our coverage of services for nutrition services remains very low. And this is actually a risk factor for both programming, but also a risk factor for the population, as we are likely to see more cases that are malnourished not being attended to, and likelihood of them also dying. So again, just to highlight, because of the funding, we are seeing a decline in terms of partnerships, specifically for Mozambique and Angola. So heavily relying on the Ministry of Health to be able to support the services. And we all know the capacity within the Ministry of Health is a little bit limited. Overall, for the funding, so we have a 77% funding gap in Malawi. We have around 79% in Zimbabwe, and Mozambique currently at 80%. So really huge underfunding, and noting that we are already in the second quarter of the year. So that will be that means that we really have a lot of missed opportunities for nutrition support. Next slide. So I'll just get into some of the details and highlights for some of the countries. And as indicated, for Angola, critical, specifically, of course, the impacts of drought, but also in terms of the high levels of poverty, with 68% of the population that are still being indicated to live below the poverty line. What we are already seeing is suboptimal diets, and of course, in terms of the feeding practices, mainly because of the access to nutritious diets, which remains very key. In terms of just the programming updates, so of course, we are still supporting the nutrition response, but then this is now limited. So we have UNICEF supporting around 7 provinces, and WFP on their MAM programming supporting 3 provinces. So again, this is currently in line with the priorities as established at the national level. But of course, we note that the burden and the need goes beyond just the provinces. But even within the 7 the provinces that are being supported, we're still not covering all the municipalities. So we have even to have reprioritization within the municipalities as of now. Now, based on the funding that is available, focus has been on the quality of care, specifically within the stabilization center, because by end of March, what we had seen specifically for some management, a lot of children are dying within our stabilization centers. So we really had a high death rate of above 10% in some of the stabilization centers, which is really above the recommended, at least within the sphere standards. So I think that is of concern, and there is now much more in terms of focus to ensure how can we limit the mortality within our stabilization centers, noting that, of course, what we are seeing is that children are presenting themselves at the facilities when they are worse off. So, of course, in terms of the survival rate, becomes a little bit minimal. So we had just discussions with some of our funders also to look at how they can be able to support active case finding. This involves community outreaches, but also looking at community models so that we can be able to identify the children early enough. So when it comes in terms of the treatment, so we've only seen around 11,900 children, a little bit of lower compared to the previous previous years. But again, I think one of the key things, we had a little bit of capacity gaps in Huila and Namibe, basically because not all the provinces have been reached out and reporting. We are still, we just started the SMART survey in Huila province, and hopefully we'll be able to get results. And if the results come out earlier before the next meeting, we'll be able to share with you some of the highlights from the survey. And essentially just to indicate that, for the RUTF, RUSF, so we have a little bit of supplies that have been provided in country, but it still remains a gap, and there is likely of a stock out, specifically from the month of June, which is almost just 1 month away. And that will be a risk factor for the children as well. Next. So for the DRC, as you all know, for DRC, we are responding to conflict, but also we have other, food insecurity as well within the country. And of course, one of the key things that has been is in terms of the priority of services that are being provided. And for this specifically, yes, we have UNICEF that is providing services as well, and WFP. We note that it is one of the countries that we have really seen a huge burden of children that are anticipating treatment in our region. So of course, we remain focused on in terms of the impact of conflict, but also in terms of the impact of food insecurity in the country. And so far for the WFP, they're targeting to reach around 657,000 beneficiaries for management of moderate acute malnutrition, but you can see also in terms of where they have been able to reach. For the month of January, you can see the numbers that had been planned as well, and the numbers that have been reached is a little bit lower, which is what we are actually seeing across the countries, basically because of, yes, we are having issues of the reach, but also the overall nutrition sector, really we are heavily underfunded to be able to reach the population in need. Next. So I'll focus on Malawi, and for Malawi, as we know, of course, for currently our response is geared towards cholera response. We have the flooding as well, and some of the gaps, because they are heading into the lean season as well. We are anticipating an increase in the number of children that are severely malnourished, though it is just worth noting that in as much as we are accelerating the response. One of the key things that we have noted is a decline in the both some admission as well as in the in some admission, and some of the things that the country is highlighting is because of inaccessibility. What has happened for the for Malawi specifically? Yes, we have around almost all the 29 districts that have been prioritized for nutrition response, but then we had to do a little bit of reprioritization to around 15 districts, and this is because of the funding as well. But also you find that some of the health workers, including the health assistants that have been reprioritized for both the flood response as well as the cholera response. So in terms of the human resource, that has been a gap. But on the other hand, we see that we have an increase in mom admission, and basically previously we really had also a slight reduction in the coverage of moms. So with the current emergencies, specifically for cholera and flooding, we have been able to accelerate the coverage and the reach as well. Though just to highlight, still our numbers are a little bit smaller compared to what we have we have reached out. Now, in terms of the response, we have a number of teams that have been deployed for both addressing the cyclone-related issues as well as the cholera. And specifically for the coordination for nutrition right now, we have activated coordination in Blantyre as well, just to make sure that, of course, we have the response closer to the population. And as such for UNICEF is deployment of teams, specifically in the priority 5 districts, so Blantyre, Sanje, Chikwawa, Palombe, and Mulanje. So that becomes part of the priority, and this is where also we will be doing a rapid assessment to look at in terms of the impacts, but also to identify that some of the hot spots for implementations of nutrition actions. So the chart just shows in terms of the progress that has been made, and you can see for 2023, which is the line in red, our admissions are slightly lower compared to 2022, and we note, 2022, specifically for the month of March, we were indicating that we really had the peak of the admissions. So again, we are really trying to monitor, though of course the curve is slightly increasing, but overall the numbers are very low, and we are looking at in terms of the options of active case finding, so that we can be able to find the children, because even our coverage based on the projections for January, February, and March, we are only at 20% of the reach. Next. So Madagascar as well, I will not get into the details, but of course for Madagascar, what we are seeing still for the first few months, a little bit of higher admissions, and specifically the high admissions, it's coming from the 4 out of the 10 priority districts that have been identified. So essentially, because we have a smart survey that is currently ongoing, specifically in the southeast, we'll be able to identify in terms of the hotspots and identify some of the triggers. And hopefully that for the next meeting, we'll get into the details and unpacking some of the results from the smart survey. But in the interim, just to indicate, of course, we have a number of, already some assumptions around the admission trends, and of course, being the lean season again, we're we are anticipating a little bit of the peak. So normally March, April, May, that is when we really have the highest admission trends. And of course, this is what we are currently anticipating if acceleration of actions will be optimized. So we are also really keen on diets as well, and we are getting in additional technical support to look at, it's not just about the counseling, but also to identify the opportunities for promoting healthy diets and working with other partners on the ground, so that we can be able to address some of the drivers, and also ensure in terms of sustainability and access to nutritious diets. The next slide is on Mozambique, I guess. Next. Yeah, so for Mozambique as well, again, for the nutrition sector, we are responding both to the cyclone as well as to the conflict in the north. And just to indicate that specifically for the cyclones, currently we had around 125 health facilities that were damaged. And most of the health facilities that were damaged were offering both health and nutrition services. So again, what we are noting with the cyclones is the interruption of the nutrition services at a facility level, but also in terms of, at the community level. Currently, from the population that we have reached because of the crop losses, they're indicating that, they really don't have access to food. Some of them, the income, the sources of income have been destroyed to some extent. And of course, just inability to afford the diets, afford the care that the children needs is being reported as, as a really gap. Now, we are anticipating that the situation is likely to deteriorate, specifically in the 4 provinces that have been identified, and specifically for for Nampula, Niassa, Zambezia. Typically, this is where we really have our highest admission trends in the normal food insecurity priority season, and these are the same provinces that have been affected by the cyclones. So the anticipation is that because usually we get to see increase in malnutrition later on in the year, we are anticipating that towards, of course, the end of April, likelihood of March as well, specifically, May and June, we will have an increase in the admission trends. So just to mitigate on that, we are enhancing our collaboration and coordination at both national and subnational level. We are looking at in terms of also looking at additional needs assessment, both in terms of the supply needs, human resource, but also looking at in terms of the programming needs. We've had a little bit of, repositioning again of nutrition supplies, and specifically some of the supplies that were geared towards the north. So we have taken some of the supplies so that we can take care of the additional needs. So essentially, we have the operations are ongoing, but again, as earlier indicated, the funding for nutrition really remains very low. So we are 80% underfunded. And of course, currently we are discussing with several donors. So we just had discussions yesterday with our ECHO colleagues as well. And of course, discussions with BHA as well as Japan to see how we can be able to address some of the gaps, and specifically for the ready-to-use therapeutic foods, because entirely for the country, if nothing comes to if there is no additional support, then they will likely have their supplies finished by June. So again, I think this is a very close up timelines, but more advocacy and follow up ongoing. Then just the last two countries, not so much into details. I think it's Namibia next. I think for Namibia, next slide. Yeah, for Namibia specifically, again, it's not one of the priority country, but the nutrition sector just wanted us also just to highlight in terms of the progress that have been made, in terms of the technical support to the districts, but also in terms of the overall nutrition response. And just to highlight specifically, there is ongoing partnership between UNICEF and FAO to be able to address some of the nutrition gaps through training of the staff, but also in terms of understanding and improving some of the referral mechanisms, the hospital and health facility. Just to note, at the beginning of the year, we really haven't seen a lot of increase in the numbers, specifically for moderate and acute malnutrition and severe acute malnutrition. But just to highlight, screening is currently ongoing, and we have our program is not really at scale, but for the areas and the regions that they have been identified as potential for potential for the decline in the nutrition situation is being prioritized, and especially the regions that are bordering Angola. So this is the regions that are being prioritized for both screening, but also cross-sectoral support, including social protection, and as well as in terms of the ECD linkages. So that is essentially for the countries. We will share the slides for more details, and over to you, Croatia.
Thank you. Thanks so much for that comprehensive update, as usual, Marjorie and WFP. Before we go, I know in the interest of time, we should be moving on to our next agenda item, but let's see if there are any questions quickly from the participants online. Otherwise, also, please feel free to put it in the chat. Colleagues, I see there are no more questions, but before we start the Malawi update, maybe it's just pertinent to mention that as part of this FNSWG, we decided to give more time to partners to present on their response and the activities to the major climate-induced hazards that we have seen this season. So we will have partner updates from FAO, from the IFRC, and from a few other partners, particularly for Mozambique, Madagascar, Malawi, and Zambia. So this is just to give context to the presentations that are coming up now. And on this note, I will hand over completely the chairing to my co-chair, Godfrey, as I am in Harare, but I'm about to also leave for a field mission. So all the best and thank you. Over to you, Daniele. Daniele, are you online or is it Chesterman? Because we still cannot hear you, but it's over to you now for your presentation.
Daniel, sorry,
Yes.
Daniel is online, so he's going to,
Okay.
to start the presentation soon.
All right, thank you.
I think we've just got some message that he's having some mic issue. So we are hoping that it's going to be sorted in the next few minutes. Alternatively, while that is being sorted, perhaps maybe we can switch over to IFRC to allow FAO to sort out the mic issues in the best interest of our time. So IFRC, is it Ruth presenting, so we can move ahead as we wait for our colleagues from FAO to get the handle of the mic issues?
Hi, Godfrey. It will be my colleagues Rasul and Vivian. So I think with Malawi to start with Vivian. Vivian, are you on the call?
Yes, I am.
Okay, over to you.
Okay,
Thank you.
Yeah. Good morning, all. My name is Vivian. I'm presenting for IFRC. I am the Cluster Operations Coordinator for Zimbabwe, Zambia, and Malawi. So my colleague from Mozambique is going to present after me. The next slide, please. Next slide. Oh, thank you so much. So, of course, we are going to touch on floods. That's what we are going to give an update for Malawi, Zambia, and Mozambique. And just to update that as IFRC, we respond through our national societies, that is Malawi Red Cross Society in Malawi. And in Zambia, we respond, of course, through Zambia Red Cross. So I'm going to give a brief update on the tropical cyclone Anna, and just to update us on some of the activities that we've been supporting the National Society and the government of Malawi to respond to the needs of the people in Malawi. So for example, I would like to highlight that even before the floods hit us, we were able to work with the Department of Climate Change and Meteorological Services to ensure that as we received the warning on TC Freddy, that is even as early as 10th of March, we had prepared, of course, our national society, availing them of resources just to start anticipatory work and early action messaging to ensure that these messages get to the communities on time and see if there are communities that can be, of course, taken to safer grounds before the impact of tropical cyclone Anna. So that's why we've put a timeline of events that shows, of course, what we were able to do even before TC Freddy hit Malawi. So I think, as you all are aware, of course, TC Freddy hit Malawi on 12th of March. Of course, some of the activities that we did, of course, is prioritizing those districts that were highlighted to be affected by the cyclone. And as you can see, of course, with our in-country partners, we have partners like the Swiss Red Cross, the Danish Red Cross. We were able to avail this funding and ensure that this early messaging reach our communities on time and can be moved to safer grounds. So as IFRC, of course, we have several mechanisms that would allow us to resource mobilize, of course, from our partners at a global reach to ensure that we get more resources and avail to the national society. And as of 13th of March, we were able to avail what was available in country through IFRC and other Red Cross movement partners in the country. Of course, with these resources, we also had to deploy some of the technical surge capacity to support the rapid response personnel in Malawi to ensure that life-saving actions like search and rescue, rapid assessments, and first aid could be conducted on time, even as we started the rapid assessments, even before the detailed assessments could emerge. By 17th of March, IFRC, of course, utilized its funding mechanism, that is by launching an emergency appeal. So this emergency appeal, of course, is going to meet the needs of over 160,000 people. I think we are all aware of the figures that have been circulated, of course, and gazetted by the government in terms of the impact of TC Freddy in Malawi. And this target of 6 million CHF, of course, is a huge funding ask on our part, but of course we are here trying to reach out to all the partners to support us so that we meet these needs. Next slide. So this is just a snapshot from the government, the dashboard that shows in terms of the impact of TC Freddy, the number of households that have been affected, the people that lost their lives, those that are still missing, and also the active camps that are still here in Malawi. And just to inform you that the Red Cross is a co-chair in the shelter cluster, and we are working closely with the government and all the partners that are here to ensure that we come up with a proper response plan for camp management and also providing resources for those households that can return back to their families now, so that at least we reduce the strain and the overstretched resources in the camps that we are having in Malawi. Next slide, please. Just images on the day before the early anticipatory actions, that is on 10th of March, before the TC cyclone Freddy hit us, and also some of the early life-saving evacuations and search and rescue actions that we did as Malawi Red Cross Society and all the Red Cross partners in Malawi. Next slide, please. So what are we doing in terms of the operations update? Pre-impact collaboration with the Department of Disaster Management Affairs. Also, then volunteers were going around using public address system, door-to-door messaging, printing early warning, early action for religious services to read out loud, using radio jingles, and just supporting communities to evacuate in designated areas before the onset of floods. Post-impact, we began the rapid needs assessment. This was initially with the government and other partners, but of course, currently there is a detailed needs assessment that is being finalized on. Post-impact also carrying out of continued life-saving search and rescue. I think all of us can attest that the life-saving actions really protracted to over 2 weeks, and those are the activities that were still ongoing. Provision of first aid and psychological first aid. I think we are very much aware of the impacts of these, the magnitude of this disaster and how it impacted the communities that we serve, but also we had to really ensure that we look for support for psychological first aid for our volunteers and also our staff who are responding and are on the ground to support these communities. Working with the hospitals, of course, in referral for further medical care. And also with the risks of floods, we had to do sensitization on hygiene and sanitation to reduce the risk of waterborne diseases. And I know from the previous presenter, of course, we are aware that Malawi, we are still battling cholera outbreak. So it was very keen to ensure that we continue this messaging even in the camps and also the communities that were still remaining in the districts to ensure that the risk of waterborne diseases and also even cholera that we are facing as a country does not spread to these districts. Cholera prevention. Currently, we are working with MOH and WHO to ensure that we set up oral rehydration points. This is just to support all the CTCs and CTUs that are being run by the government and ensure that we break the chain of transmission for cholera. A big thing, of course, post-impact is provision of food and non-food items to evacuation centers, and we are still mobilizing for more. Now that we are all aware of the impact and the magnitude of TC Freddy. Next slide. Yeah, so the emergency appeal that has been launched, I told you before, 160,000 people. So we are targeting 32,000 households. So this is a bigger appeal that is going to be responded to, of course, bilaterally and multilaterally by all the Red Cross partners. And so far, of course, we've been able to avail over 1 million to the National Society to start responding to the needs as we now are heading towards transition, and also as we build up to recovery from this huge cyclone. So it's targeting 5 districts, and it's the districts of Palombe, Mulanje, Chikwawa, Nsanje, and Blantyre. But we will be having some of the activities, activities reaching also to Cholo and to Mangochi. So as you can see, shelter, about 20,000 households, livelihood, about 5,000 households. MPCGs, that is 10,000 households, healthcare, 160,000 people. That's the entire population of the appeal. WASH is also the same, PGI and DRR programming that is going to the appeal. Next slide. So sorry, it looks very tiny, but these are the districts that we are going to start and also continue with the interventions. That is the 5 districts that I was able to indicate, and also Cholo and Mangochi that will be having some small activities under this appeal. Next slide, please. So that is just for Malawi, and just to touch on Zambia, I think we are also aware that in January to February, we received huge rainfalls that resulted in floods. But just to highlight some of the programming that we have as IFRC in Zambia, is we have been implementing an early action protocol for floods that has been operational since 2020. And of course, this is a system that we set triggers that the responsible stakeholders are supposed to monitor these triggers. And once we reach a trigger, then we avail funding to the country or Zambia Red Cross to, of course, respond to the specific hazard. And for now, we are talking about floods. So in Zambia, of course, in January, we received an alert on the impact-based forecasting and global flood awareness system. Of course, this is a system that detects the riverine flooding. It's supposed to connect to water gauge stations, and it's managed by the government Water Resource Management Authority on water bodies across the country. So of course, this system was able to be triggered and show us that there is a likelihood for Zambia to experience floods in 10 districts and affecting over 100,000 people with the districts that have been indicated there. So this trigger, of course, when this threshold is reached, we are notified through Zambia Red Cross to trigger this, to avail the funding now for response activities. So of course, we were able to activate this early action protocol, and it was implemented in 7 days, and we targeted 1,000 households in Kitwe district on sectors in WASH, shelter, and also ensuring that we continue early warning information so that at least we reduce the impact of the flooding, of course, on the communities that we serve. So yeah, this early action protocol was on time. Of course, it helped us as Zambia Red Cross IFRC to ensure that we could pass the early warning messages to the community to move to safer ground, and also support in response to the affected households, of course, in one of the districts that we had budgeted for. Next slide. So another mechanism, of course, that is available for IFRC to support the national societies that we work with is using the Disaster Response Emergency Fund. And when the floods in Zambia increased, of course, towards February, we were able to increase the funding and support now the country in responding to the floods. And of course, according to the Zambia Disaster Management Unit, it was really very severe, and it was the flooding is more than what has been experienced, I mean, in the last 50 years. So of course, as we can see, the flooding in Zambia affected over 150,000 people. And there were 5 districts that were affected, but as IFRC and Zambia Red Cross, we only prioritized 3 districts that were really impacted. And some of the interventions that we've been able to do so far up to today, the funding is going to end in the next 1 month. So we were able to have multi-purpose cash and voucher assistance that is targeting close to 800 households. Cooking shelter and household items targeting over 1,300 households, and also wash programming to over 8,000 people, where we constructed temporary latrines, chlorine and water storage containers for water treatment, and also continued hygiene promotions through our trained volunteers. So at this point, that is just a small update of what we are doing in floods in Malawi and Zambia. Allow me to give, that's just pictorial of Zambia and the work that we are doing in Zambia. Allow me to pass over to Rasul to just complete on Mozambique situation. Thank you so much.
Thank you so much, Vivian, and colleagues. Good morning from Mozambique. My name is Rasul Nasego. I am Disaster Management Coordinator for Mozambique and Angola. So I will be here sharing about Mozambique, especially on the tropical cyclone Freddy situation and response for IFRC. So as we may be aware of the humanitarian humanitarian assistance that in terms of challenge of humanitarian assistance in Mozambique in the face of tropical cyclone Freddy. So we have over 1 million people in need in 8 provinces of Mozambique. This includes center part and northern part affected by floods and cyclone. Special, the cholera is kind of aftershock. Of course, we have been experiencing cholera before Freddy, but for these provinces, these increased in terms of risk for spread of cholera. So in terms of farmland is around 391 hectares of farmland that were affected. This also put the communities in high risk of food insecurity. Already we were experiencing before Freddy, but this increased their vulnerability to food insecurity. Next slide, please. Also ongoing. Thank you. Yes, in terms of IFRCs, as you may know, and my colleague highlighted here that we work through our national society. So in terms of readiness and preparedness for tropical cyclone Freddy, we have been, since we work in coordination with the disaster risk management authority in Mozambique, since the forecast of this cyclone, we have been working towards the update of the update and also proposition of our stock in Mozambique, ensure that we have in the provinces close to landfall, ensure that we have NFIs or proposition in stock to assist people that will be affected. So we were able to activate around 1,000 volunteers. These many refreshment sessions on first aid, PGI, community engagement and accountability, health services. It's to ensure that our community are ready to save life. So we also, through these first aid activities, we ensure that they have life-saving skills to attend. In another hand, also we activate the DRM committees that we have around the provinces close to landfall. Of course, our volunteers also have been supporting the dissemination of early warning messages in the district at risk. So we are deployed at headquarter level around 10 senior staff to support. This is mainly DM staff, ELF staff, and emergency team to support this operation in Zambezia. So here mainly we are talking about the second landfall, not the first one. So also we have been discussing in the first landfall, we were able to launch a draft for 207,000 CHF with a possible scale up to 1 million. So right now we have already reviewed and we have approved 900,000 CHF to support our ongoing response. Of course, I would highlight the coordination with the internal coordination with the Red Cross Saint movement, and of course the humanitarian. In terms of coordination, also we have humanitarian country team that and EOC meetings that we participate. We also are part of these meetings, or with the some partners like WFP that. So we are being in coordination with them to support like different clusters, UN clusters. Of course, also we have private sectors that has been supporting in our response, like Coca-Cola company, which provided food parcel and also safe water for the communities. As you may know, Zambezia, we had problems of water, and the pumps were already cut off, so communities were lacking water, and this was, one of the contribution of the Coca-Cola company. Internally, would thank to our PNSs in country, our partner national society in country, Belgian, Swedish Red Cross, and French Red Cross, of course, and Portuguese and German. We have around six partners national society in country. Next slide, please. So still under the response, we have been we supported the joint the intelligence joint need assessment. Currently we are on distributing NFIs in Zambezia, especially in Zambezia, because Zambezia is one of the provinces that was most affected. This is a line, if we can, we see only about the flooding. We are we are sharing about the flood response, but of course we have ongoing cholera response that we are supporting in Zambezia. Of course, we have planned, as I mentioned before, we have around 8 provinces affected by cyclone DC Freddy, and one of them is Niassa province. This is us border also with the Malawi. So we have already planned to distribute food parcel for around 1,000 households. Of course, also our activities goes not beyond food distribution in NFIs. We will have wash awareness session, and of course rescuing and PSS support to those affected communities. Next slide, please. So this is the work, these pictures show the work of our volunteers in the accommodation centers, and also the distribution that is being made of family kit and shelter kit that we are currently doing in Zambezia. Next slide, please. Thank you so much. I will hand over to my colleague if there is any question and feedback. Thank you so much.
Much IFRC for the detailed presentation on what's happening in Malawi and Mozambique. I guess, colleagues, it's this will help us to also see what's happening on the response side of the equation. Most of the times we are talking about the food insecurity issues that are found in some of these countries. But then the question is what practically is happening there. So I guess by way of these presentations, we are having a chance to also see the sort of response that we are happening to some of the areas that were affected by the cyclones. So colleagues, I don't know if there are any questions at the present moment. If we have any questions, please throw them in the chat box and perhaps also raise your hand. So far, I have nothing in the chat box. Okay, there is Marjorie. If you can quickly raise your question.
Yeah, thanks so much, Godfrey. I think I put it also on the in the chat box. So thanks so much, colleagues, for the detailed presentation. Just one question in terms of the food basket, what it contains, and if we are able to meet the needs, including the nutrition needs of women and children. Thanks, and over to you.
Thanks, Marjorie, for that comment. I don't know if there's anything that our presenter would want to say on that. If you want to add anything. Otherwise, I'm not seeing any other questions. So I'll just leave IFRC to probably make a comment on Marjorie's contribution. If there's anything.
Thank you so
Vivian,
much.
Russell.
Thank you so much. Yes, our food pathway is included, I think, the nutrition side, because it's a basket that is approved by Ministry of Health and also by our partners that are in country, including WFP. Actually, we also rely on their on this food parcel. Mainly, we have beans. We have I may not cover all, but we have beans, oil, we have sugar. Maybe I can in detail put in our PowerPoint presentation so that all colleagues are aware. But it's mainly that the approved basket from the Ministry of Health, and I believe it's included the nutrition side.
Thanks for that response, Russell. And I guess on this note, I just want to thank IFRC once again for that detailed presentation, showing us what's exactly is happening from the partners in terms of response. So I'm going to try Malawi again. I'm hoping that the mic issues have been sorted. So over to you, FAO Malawi, on Malawi updates. If we can also try to be as brief as possible, because we are also battling a bit with our time. We're supposed to be having Daniel to present. Are you there? I'm not too sure if the problem has been sorted, but probably I think in the best interest of our time, we can switch over to the presentation on Zambia that is still also coming from FAO.
To unshare my screen because Zupa is going to share his own screen.
Okay, colleague.
Good morning. Good morning, Chair. Can I go ahead, or has the Malawian issue been fixed?
Yes. Can you hear us?
I can see, is it Kumwenda? Are you supposed to be presenting for Malawi?
Yes, I'm Daniele Barelli. I'm the head of emergency. I'm relatively new, and I will present from Chesterman computer since mine had a breakdown. Apologies about that. Can you hear me loud and clear?
You were kind of breaking up, so maybe yeah, it's gonna improve. Let's try again.
Okay. Thank you. So I think we can start with an update from our side. If you can, basically what we would like to provide is an update on the impact of the tropical cyclone Freddy, what we have done together with the cluster in terms of the response plan, and of course other partners, provide an overview of the recommended response interventions as part of the Cyclone Freddy response, finding requirements also, and giving you an idea of the presentation of the flood assessment results we have conducted recently, plus provide an update on the food security situation and what we intend to do in terms of emergency response and preparedness for the current and next year. I think our presentation will be too long since I've been requested to do it in a short way. So I will just, please, if you can move on the next slide, I will just give a quick update on everything we have prepared for you. So first of all, as you know, and as already commented by the colleagues from the Red Cross, Malawi experienced very harsh weather condition in March, after especially the tropical cyclone Freddy, who hit the country around the 12th of March. On the right side, you can see the trajectory of the cyclone coming from indeed Madagascar and entering into Malawi, as you can see from the red circle. And then you can appreciate basically the amount of water, especially shaded in blue, that hit particularly the southern part of Malawi, whereas the northern part remain still affected by heavy drought at the moment. Going back to the impact of tropical cyclone Freddy, colleagues from Red Cross already provided figures in terms of people that have been affected or that were dead or reported missing or injured. So I will not focus on this, but in terms of impact on agriculture, we have about over 200,000 hectares of land that have been affected, which resulted in more than 500,000 farming households affected, whereby about 1.4 million livestock species also have been affected, with major losses in terms of poultry, about more than 1 million reported losses in poultry. Indeed, we have also some impact on the irrigation. In Malawi, schemes, about 190 have been declared damaged. And as I mentioned, the southern part of Malawi was the most affected, about 13 districts, where about 100,000 people were directly affected as a result of the cyclone. Next slide, please. Okay, so soon after the cyclone, the government put in place some post-disaster needs assessment. The first one was the interagency rapid assessment that was led by DODMA, immediately following the cyclone. Then FAO conducted a rapid flood assessment together with NASA and the Ministry of Agriculture, NASA Cropland. And after that, there was a national exercise called Post-Disaster Needs Assessment in the country, which concluded last week. Is a multi-sectorial assessment that is done after major disaster requiring international support. And the results of this assessment are showing that over 110 million US dollar resulted in terms of damage and loss to agriculture sector, with the respective recovery needs estimated at about 94 million US dollar. Please, next slide. So I think we don't have much time, so I will just mention that for what it relates to the agriculture cluster response plan, we have, together with the government and partners, develop a kind of a plan to respond in between April and June. So it's a short-term response plan, basically, which is targeting approximately 280,000 households in the 13 affected districts, and as a funding requirement of about 24 plus million US dollars. If you can move on the next slide, please. Most of the immediate response intervention, according to the agriculture cluster, are related to the procurement and distribution of seeds, different varieties, as well as cuttings and inputs such as fertilizers. In terms of the requirement, we are trying to push to have all the necessary procure within the second half of May, because we are targeting households which have still residual moisture in their ground or soil, better said, and access to irrigation farming, so that they can plant and take advantage of this situation in terms of moisture, residual, and irrigation availability. Next slide, please. Okay, as I mentioned, FAO conducted together with the Ministry of Agriculture and NASA Harvest a rapid assessment following the Cyclone Freddy to try and estimate the impact of the floodings on crop and livestock production, as well as any other productive infrastructure and fishery or aquaculture sector that was affected by the cyclone. Now, our assessment was conducted in about 11 districts in total, southern part of the country. In the right hand side of the slide, you can see the targeted district for the assessment. We did household level interviews targeting more than 2,000 households, and also interview extension officer based on the various districts to collect, as I said, information on the impact of the cyclone and floodings on agriculture. Next slide, please. This was done during the first 2 weeks of April, let's say first half of the month of April. And of course, I mean, I will not go into the nitty-gritty of these results because we don't have time, but most of the farmers that we interviewed reported impact on crop production, and 80% of their field have been affected by flooding, resulting in crop production losses. There were indeed heavy flooding which occurred and lasted also for over eight days in certain areas. As I mentioned, there was a high mortality of different type of livestock, especially poultry, and also other animal like goat. And indeed, there were also impact on about 900 irrigation schemes, according to the results of our survey, and more than 1,867 aquaculture farms were also reported to have sustained some damage following the cyclone. Next slide, please. In terms of also food security situation related to the results of the assessment, it seems that indeed people have been having issues in basically mainly rely on their own production and market purchase following the cyclone. However, the majority of them, 72% interviewed, reported not having enough money or resources to buy food. A lot of them were also starting to borrowing money, food, and getting a gift from friends and relatives. But overall, it seems that access to market is not an issue. Functionality of the market is still there, and 91% of the farmers reported to have access to usual markets. However, there is also some issue in terms of storage of food. A lot of households have reported that they don't have sufficient food for a supply until next harvest, and their households consumption needs will be no more than 2.7 months in terms of what they can sustain. So definitely there is probably a need also to look at this food availability requirement within the next coming months. Next slide, please. It's not moving. Okay, thank you. So in terms of an update on the food security, I will leave my colleague Chesterman to give you a quick overview.
Thank you so much, Daniel and colleagues. So in terms of food security situation, actually, at the moment as a country, we should be in the harvesting phase, meaning that largely most of households should be able to be accessing food from their, from their own production. However, the impact of tropical cyclone flood, because it happened at a time when we were just nearing the end of the lean season, so it actually affected about 1.6 million people who were rendered food insecure, largely because their production, which was almost mature, was affected. And again, some of their household food stocks were also washed away. And also the issues of displacement meant that some of their livelihoods were disrupted and some of their productive assets were also washed away. So this put a larger population in the southern region, which was about to recover because of the harvest season, to continue to be food insecure. So WFP, the government of Malawi, through the leadership of the Department of Disaster Management Affairs and WFP and other partners, are actually providing immediate food support to the affected people. So far, WFP alone has provided food assistance to about 97,000 people that were affected in 4 out of the 13 districts that were affected. WFP also plans to provide complimentary food basket targeting 715,000 of the affected people. Now, according to FNSWG Malawi, there is a projection that the national crop production for the 2022-2023 season is expected to be below average, with a very likely deficit of 20% or more in the southern region. Districts that have actually experienced that are expected to experience huge losses in terms of food production are Chikwawa, Palombe, Sanje, Zomba, Machinga, Mulanje, and Mangochi. And these were among the districts that were severely affected by tropical cyclone flood. So in terms of maize prices, FNSWG has observed that in the southern region, there is actually a substantial increase in prices. When they monitored some markets across the southern region, they observed that there was a very sharp increase in maize prices. Maize is the main staple crop in the country, such that maize prices were as high as 300% above last year's prices, almost near 170% above a 5-year average in the past. So this actually means that the situation in the southern region, especially in the districts that were severely affected by tropical cyclone flood, the situation is not that good at the moment, which is a very unusual situation, as I said already, because this is supposed to be the beginning of the new consumption year, and actually we expected that most households by now should be harvesting and should be accessing food from their own production. The situation in some districts in the south is going to be different. This now calls for the need for early recovery interventions to support winter crop production, irrigation, and also to restore some of the livelihood options that these households are always engaged into. Next slide. Yeah, so the next slide is basically just to give you a projection of acute food insecurity. This was picked from the FNSWG site. So FNSWG has projected, an acute food insecurity situation from March to May. That indicates that most of the households, most of the districts in the southern region are going to be in phase 2 and phase 3 of IPC, which, as I said, is not a normal situation, because at the moment, we expected most of these districts to be either in phase 1 large, and maybe very few of them maybe to be in phase 2. So this is rather a very difficult year for the southern region for Malawi. Thank you. I think let me stop there and let me give again to Daniel to finish with the last slide.
Okay, thank you very much. Just the last slide, Godfrey. Yes, please.
Okay, if you can probably wrap it up in 2 minutes because we really are running out of our
In
time.
1 minute. So, okay, so in terms of an emergency preparedness, response, and recovery, FAO mobilized about $500,000 now in response to Cyclone Freddy, and we are targeting approximately 4,500 households across 3 of the most affected districts in the south. Indeed, we are also discussing now with the EU donor about repositioning some funds we have as part of some development project to respond to the emergency, and hopefully we could mobilize additional 3 million to target additional 20,000 households. However, this is under discussion yet with our donor. Indeed, we are launching an anticipatory action project as part of FAO work to help vulnerable farmers who might be exposed to the effect of El Nino during the next agricultural season. And we also develop an internal emergency preparedness plan to speed up the response mechanism within FAO Malawi. During the last agricultural cluster meeting, we also discussed with other partners and Minister of Agriculture about the importance of operation prepositioning in relation to emergency response and procurement for special agricultural input, which might be necessary next year or following any other major disaster. This is a very important point for FAO because we realize that there must be, inputs and goods that are required soon after the disaster strike. And sometimes it takes too much to really procure and distribute the special agricultural input. So we need really to shorten the time between procurement and distribution. And finally, I think what we want to point out is that FAO will continue to support the preparation of a more medium to longer term recovery plan for the agricultural sector, especially following the results of the PDNA exercise. And indeed, we also are ready to assist the Ministry of Agriculture within Malawi, and why not maybe in the region, to provide a refreshed PDNA trainer, post-disaster needs assessment trainer, for all the ministry and partner personnel who are interested in understanding more about this methodology and, of course, learning more how to apply and use it. Thank you very much, Chair.
All right, thank you very much for that update on Malawi. Colleagues, in the best interest of our time, I'm just going to request that we have the one for Zambia, and then we combine our questions. So if we have any questions, maybe we can drop them in the chat box, or we can reserve them, and then we do that once the Zambia presentation is over. And if I can request that we try to have this done by, I mean, if you can just do it in about 15 minutes, please. Our time is really fighting against us. So if you can have it in 15 minutes time, the better for us. So over to you, Zambia.
Thank you very much, Chair. Just kindly allow me to share my screen.
Sure.
Are you able to see my screen?
Yes, we can see. If you can switch to the, oh yeah, sure, it's fine, it's okay. You can go ahead.
Okay. My name is Zuwa Mwanza from FAO Zambia, and good morning once again. So from Zambia's end, sorry, excuse me, following a downscaled seasonal forecast that was conducted or made available in the end of 2022, specifically in December, DMMU, which is Disaster Management and Mitigation Unit, which is our disaster management authority in Zambia, with support from UN agencies and other partners, managed to develop a national contingency plan. With regards to the focus that I referred to, it was expected that Zambia would largely experience normal to above normal rainfall in the 2022 to 2023 rainfall season. And also, according to that national contingency plan that we had developed, specifically 2 districts out of the total 116 districts that we have in the country were identified as likely to be affected by floods. And also, I think it's worth noting that between the period January and February, Zambia experienced some heavy rains and flash floods in various parts of the country, specifically in the eastern, central, western, and southern provinces, which led to widespread, considerable amount of damage to infrastructure, as well as to field crops and also livestock enclosures, and as well as road infrastructure. So, including bridges, were affected by that. In terms of response for Zambia, Zambia activated its cluster cluster protocol, so to speak, for the 2023 floods emergency response. So Zambia has 10 separate clusters, which are really strictly speaking sectors. So FAO and WFP on the partner end or the UN agency end were assigned by government to co-chair specifically the food security, agriculture, and livestock cluster. Apart from that cluster, we have the health cluster, the nutrition cluster, the education cluster, a logistics cluster, and several other clusters. So, but for the relevance of this presentation and also our meeting, the cluster that would apply and what we have been doing, I guess it would entail the food security, agriculture, and livestock cluster, which, as I indicated, FAO and WFP have been asked to co-chair. Following that activation of that cluster system, DMMU, with support from UN agencies and other partners, including Red Cross, undertook a 7-day rapid assessment in 5 affected provinces, which were covering 38 districts. Kindly bear with me, I have challenged my throat. So in light of the data or information that we were able to collect in that 7-day rapid assessment that was conducted in the mentioned 38 districts, Zambia managed to develop a humanitarian response plan for the period February to April of 2023, as well as a floods response plan for the period February to July 2023. So in terms of overview of the situation in the country, in Zambia, I think partly this has been alluded to in the earlier presentation, especially the one given by Red Cross. I think the slide shows the affected population and also specifically people in need and then people targeted. So the affected population essentially is with reference to the areas within the districts that were affected by the flooding, and the people in need. The people in need is with regards to the people that were affected and were actually in need of assistance, because some people were affected by the floods and yet did not really suffer any damage to either their infrastructure, their crop fields, or even their livestock, even though they were within the area that was affected by floods. So hence the difference in figures between the people affected and people in need. And then people targeted has to do with, in light of available resources, how many so far have been targeted with the interventions that have been implemented or are currently ongoing. And then on the other side, we have resource requirements, which are in USD. So this is $3.5 million US as what was deemed as resource requirements to be able to effectively respond in terms of humanitarian response, and then also this is the amount that had been received at the point that the report was being put together. And these are the gender disaggregation figures with of the people targeted by gender, 71,000 being male and 74,000 being female. The next slide shows, according to sectors, how the targeting was done. And so we have at the top the food security, agriculture and livestock sector or cluster, under which we had a total of 203 or 203,000 people being affected by the floods, and then 139 being targeted in the humanitarian response or proposed interventions. And the same was true under the WASH sector or cluster. 160,000 were affected with regards to water and sanitation and sanitation facilities, and 100,000 were targeted for assistance. And then under the education cluster, 75,000 were affected and only 17,000 were targeted. Under protection, those are the figures. Under nutrition, those are the figures. Under health, those are the figures. And then with regards to shelter and non-food items, those are the figures in terms of people identified as absolutely in need of assistance for shelter and non-food items, and the total number was equally targeted. And then on the other side, these are resource requirements to be able to address the needs on the other end, and these figures are in US dollars. In terms of proposed activities or activities that were planned for implementation under this humanitarian response plan, this is the list of activities and on the other side, the list of agencies or institutions, organizations that partnered with government, specifically the Disaster Management and Mitigation Unit. And these were the resources that they had allocated to the response work or implementation of the proposed interventions under this humanitarian response plan. I also mentioned that Zambia had developed a floods response plan for the period February to July 2023. And under this response plan, these are the figures of the affected, those in need, and those targeted. And the figures this side are in local currency. Unfortunately, I couldn't really, I didn't have time to convert them to US dollar. But in the floods response plan for Zambia, they appear in local currency, and those are the amounts with a separation in terms of the two categories of response: immediate response, which was scheduled to or planned for to be undertaken between February and April, and then early recovery, which was planned for between May and July. And that was those were estimated funding requirements in the local currency, 1.3 billion kwacha. And then these were 40 million kwacha was mobilized at the point that the report was being released or made available. And then on the early recovery side as well, these were the resource requirements, and this is what was made available or resource mobilized at that point. In terms of planned activities under the floods response plan, specifically under the food security, agriculture and livestock sector or cluster, this is the list of activities that were planned within this floods response plan, and a number of them have either already been implemented or are currently ongoing. So in terms of response, already a couple of rapid assessments have been undertaken and information has been gathered. And from that information, besides the 2 response plans, there is already some activities that have gone on in terms of implementation of what is proposed in these 2 response plans. Just a few photos from the rapid assessment that we undertook, and these are in Northwestern Province. These are affected households. These are mainly in rural, the rural parts of the province, which seemed to be affected the most. The urban areas were equally affected by floods, but very little damage to infrastructure, and many of them livelihoods were not affected. Whilst in the rural areas, the flooding resulted in field crops being completely inundated or flooded, and in most cases resulting in crop failure, and then also for some, their livestock enclosures were flooded, although very little fatalities in terms of livestock, but probably rendering them at high risk of transmitting or spreading livestock diseases, especially foot rot, for example. On the western part of the country, we experienced some prolonged dry spells, which led to crop failure. As you can see, a number of fields were completely dried up as they went through a 5 to 6 week period of completely no rain halfway through the rain season, and therefore many of them lost their crop. Although there are a few, there are certain parts of the Western Province that seemed to receive a relatively good amount of rain and their crop did really well. But unfortunately, many of those were located within game reserve areas and therefore very close, fairly close to national parks, and therefore they suffered significant losses in terms of livestock coming to damage or feast on their crops. Specifically, elephants were cited as a nuisance in the western part of the country, and especially in Senanga and Sioma districts. And then on the eastern side of the country, we recently had reports of flash floods, specifically in Chama district, given its proximity to Malawi and the impact of the cyclone Freddy. A number of crop fields were damaged due to those floods that came through, and also considerable damage to infrastructure, which also led to some casualties as people were injured when their infrastructure were collapsing or houses were being affected by that. In terms of the food security situation, I think this has partly been touched on in earlier presentations. Even the price and market information, I think, did touch on the situation in Zambia. But according to the DMMU rapid assessments, we got an indication that a considerably high number of households that have been affected are currently using or adopting negative coping strategies. And also with that estimate, 75% of households in the affected areas seem to be adopting negative coping strategies, and then 83% are clearly in need of immediate assistance. And then according to the
if you can sum
report,
up, if you can please sum up, Mwanza, we really are running out of time.
Okay, I'm almost done. According to the assessment report, more than 2.3 million people in Zambia were severely food insecure and in need of humanitarian assistance. as at February 30th. Then, of course, the price hikes that were earlier referred to with regards to maize grain, maize seed, and fertilizer in the past 3 months. The situation might improve, of course, as more farmers harvest and bring their produce to the market. And then also the export ban and removal of tax on imported maize meal or flour is also likely to improve the situation with regards to maize prices, maize meal prices. And then in terms of FAO support, largely we have been working alongside the UN, other UN agencies to support GMMU, and I already cited the 7-day rapid assessments that were done in the 38 affected districts. FAO was one of the 4 UN agencies that supported logistically and financially the undertaking of that assessment. And then also the more recent assessment I referred to, which was being done in Sioma and Chama districts, FAO supported the MMU in the undertaking of that particular assessment. And then also currently FAO is conducting an IPC training workshop aimed at building capacity in 47 government officers, mainly from DMMU and other government institutions that are part of the Zambia Vulnerability Assessment Committee. And then lastly, it's the review. It's the fact that we have a review. We also are doing a review of the data collection tool that will be used in the in-depth vulnerability and needs assessment that we annually conduct as a country. FAO is helping GMMU to review this tool and also will be posed to support the analysis of the data as soon as it is collected, probably in June. The data collection will take place in May of 2023, but the analysis will be done in June, and therefore we should be able to support them. So currently FAO is just trying to mobilize resources for the implementation of recovery interventions aimed at restoring livelihoods and building resilience. So in the interest of time, I will end here. Thank you very much, Chair and all.
Thanks, Mwanza, for that presentation, which I guess for us colleagues who have been following, you can almost see the devastating impacts of the cyclone-related floods and also the dry conditions that were experienced in some portions of Zambia. I think this presentation has really helped because I think over the past few months, we have not had quite a lot of coverage on Zambia. So thank you so much for that presentation, colleagues. Do we have any immediate reactions, any quick questions? We just have 2 minutes for that. If we have anything, you can just raise your hand or just drop in the chat box. If I don't see anything, we'll move ahead with our next, right. I see Pamela, if you can go ahead, please.
Hi, Godfrey. Thanks. Just a quick question to Malawi. I'm not sure if I missed this, but I wanted to find out, well, first of all, thanks for the great presentation on the impacts of flooding. But I wanted to find out if they have any information of the significance of dryness in the northern region in Malawi and the implications of that on final production, because I think he mentioned that national production is expected to be below average, but I want to know if the dryness in the northern region has significant play into that. Thanks.
All right, Kumwenda, if you can respond, please.
Yeah. So thank you so much for that good question. Yes. So we have a report on the dry spells that have occurred in the northern region, and actually it's mostly in one district, which is Karonga. And in Karonga, it's actually in 2 extension planning areas where the dry spells have been severe. But then, we are yet to do a thorough impact assessment of the dry spells in terms of how that one translates into overall production for the district. So this is going to be done when, the MVAC very soon, they are going to initiate the usual annual assessments. And hopefully at that time, we should be able to quantify the actual, loss in terms of production as regards the dry spells. Currently, what we have are just the locations where the dry spells occurred, how the impact has been, but we haven't really quantified the contribution of the impact to total production. So the 20% projection that I pointed out in the presentation for the southern region, this has been, done by FuseNet. So this is just an unexpected production loss. However, we are yet to get actual figures from government because they only did the first round of agricultural production estimates. We are expecting the second round figures anytime soon. So once we have those figures, we will be able to know in terms of national production, what would be the actual expected overall production. So for now, these are just indicative figures, but yes, we have pockets of dry spells in the northern region, which likely are going also to impact on overall crop production. Thank you.
Thanks, Kungwenda, for that response. And I guess, colleagues, we can also, once the meeting is done, you can also probably have a time to, you are free to also kind of chat with the presenters on specific questions. Allow me to quickly move on to the next agenda item, which was supposed to be the nomination of the non-UN sector co-chair. Just to update you that we have been working tirelessly to get this process completed, but unfortunately up to this point in time, we haven't got any volunteers to act in that capacity. So we have pushed the nomination by another 30 days, which is up to the next meeting in May. So, and we are appealing to members to please submit your nominations so that we don't create a constitutional crisis. Practically, this should be my last time chairing in line with the set protocols for the FNSWG. So I would like to appeal to all of us to please consider this important position of service, which helps to make sure that we keep on driving the agenda that we have as a working group. So we are leaving probably in the next 2 weeks. We just want to request once again that we submit for those of us who were considering and had not acted, please feel free, be brave, and show up so that at least in May we conduct our elections and make sure that we move ahead with this process that needs to be completed. Otherwise, I think from the coordination desk, that's all that we had. And I just want to thank all of us for being very patient with a rather long session. There were so many presentations, but I guess the benefits have been that we had an opportunity of understanding first-hand information on what's happening in the countries that are covered by the work that we are doing as a working group. I'm sorry for the 1 minute that I stole from your time, but otherwise, given the circumstances, it could have been worse. Otherwise, colleagues, I just want to thank you and wish you all the best. Have a good week. For those of us who are going to be participating in Riasco, we will meet again on Thursday. Otherwise, we will meet in May. All the best and goodbye to all of us.
Thank you.
Thank you. Bye.
Thank you. Bye-bye.
Thank you. Bye.
Thank you. Bye.
Right, thanks. Bye-bye.